I'm Stephen Guilfoyle with Afforded Care Insurance, and we're going to talk about Champion Health. And so today with us, we have Curt with Piggly Wiggly. Now, most of the employers that are watching this right now understand the concept of Champion Health. They love the idea. But at the end of the day, you still can't help but think that it almost sounds too good to be true. The savings, the benefits, the app, and everything with it, right? And so for someone who's been on this plan for a couple years, what would you say to somebody who, business owners like you, that would say it's too good to be true?
Well, I thought the same thing, to be honest, Stephen. And in fact, my employees always came up to me and said, what is going on here? This seems too good to be true. Is this going to be something that's going to affect me in the end? Is the IRS going to come after me because of the tax savings? And honestly, it has been better after since year one. Year two's better. Year three's been even better. So the savings keep coming in for us and for the employees, and they get all the benefits of the Champ plan. So we're super excited that we joined 3 years ago.
Awesome. Well, we're super happy to have you as well. And I guess like your initial, when you're first approached, what was your initial thoughts, I guess, that got you so excited about it?
Well, the initial thought was I actually thought, okay, this is going to help our regular health care too, because this way it's something our employees can use before they even touch the health care that we have for them, which is going to help them because this way they don't need to be paying money out of pocket for deductibles. It helps us because of the fact that then we are going to keep our rates lower, which is going to be benefiting us along with the tax savings that we're receiving with the Champ plan as well.
Awesome. Okay. So, most employers I meet with, they agree the savings is a no-brainer, but I'd say the most common question we get is how easy is it for the employees to actually use it, and are they grateful for it?
Well, as far as grateful, who knows if employees are grateful for anything nowadays, but to be honest with you, I think they are. And as far as use, they use it, they have that card, they go in, they use that first before they do anything with the healthcare. So I've had about 10 people that came out to me and said, you know what, I really am glad I'm on that plan. In fact, I had 2 people that the original year, they did not buy into it. They did not want to go on the plan. After other employees talked about it, guess what? They're on it now. So now I have all my employees on the Champ plan.
Wow. Now, I know, and this is another thing we've talked about in the past where, people that have an existing major medical plan in force, right? So, of course, there's that plan. And so, I guess, can you talk about maybe how this enhances it, maybe kind of with those copays and your own experience with that?
Yeah, exactly. So, like you talked about, Stephen, it really helps out because of the copays that you have with the actual healthcare plan that we have is now benefiting by having the Champ plans. So this way it's a whole separate entity, but yet again, it actually helps with that. And in fact, it's funny because my healthcare provider I work with says, well, how come your rates are so low? And I'm like, well, I'm working with the Champ plan. So guess what? Now they want to actually work with you as well. So I gave them your information, so it's actually a win-win. So to any employer who actually is real hesitant on it, I say go for it. And actually what you could do is you could partner up with your health care provider you have now with the Champ plan and actually make it a synergistic situation for you.
Yeah, and to kind of expand on that, I know with a lot of times with brokers, like for instance, companies that have been with their broker for a while, they don't want to damage that relationship. They've treated them well and they don't want to, go anywhere, right? And so, with the Champ, what to me, I think one of the best parts about it is it doesn't push anybody out. You don't have to pick sides, and this actually helps the plan, right?
Yeah, it basically is the transition into something that's unique that nothing has I've ever seen before. When I was introduced by Matt, one of your folks from the Champ plan 3 years ago, and we talked about it, and he told me about it, I was like, this does seem too good to be true. But then once we got going on it and got excited about it and saw the savings from an employer standpoint, it's just a no-brainer. And like you just said, it's actually something that it doesn't affect at all what we're doing with the other healthcare provider that we use.
Yeah. No, I know like in this case, like, as word catches on, this spreads like wildfire. And so like at this moment, we have anywhere from groups of 5 people to 500,000 that are looking at rolling this out to their employees. And, and as a big name, yourself, of course, I know you've done your due diligence before rolling this out to, the whole company, right? Because these are people's livelihood that depends on you for lots of reasons, right? And so I guess, could you share what you've done, I guess, to kind of do that due diligence that's helped you feel confident and make that decision and roll it out?
Yeah, to be honest, what we did is we actually talked about it in our management group. We talked about rolling it out just to them first. And then we actually rolled it out to all the full-time employees after we got them going on it. Because again, once you had them buying in, then it's a situation where others will follow. And what's really cool about this is that we actually have up in the Midwest in Wisconsin, I'm one of 85 different Piggly Wigglies. We have a lot of other owners who own maybe one or multiple stores, that a lot of them are actually getting involved with the Champ plan because of the fact that they see the success. So we're like a model store up in our area and a lot of things we do. So that's why you have myself talking with you today, because you know that if I'm involved in something, it's got to be good, and my employees love it, and other Piggly Wiggly owner operators, they love it as well.
Yeah, and that's one of the cool things, I guess, is that this is beyond just, the benefits. Is beyond just the app. I mean, there for the employees, the savings, this is actually like a livelihood. And again, we have employees that are saying, it feels too good to be true because I'm basically getting paid to have extra insurance that helps my plan. So are the employees, in your case, are they actually seeing an increase in their paycheck?
They're seeing an increase in their paycheck. And here's the one thing we're going to talk about. We're actually seeing healthier employees because they're actually on a monthly basis having to do a little bit of work, put a little skin in the game as well. And it's really not that much more work, but it helps them out from the standpoint of actually looking at their health is something that's a priority.
So I think one of the easiest ways that I kind of equate it to is like, everyone is used to kind of like that safe driver app for your car, right? And so it makes sure that you're a safer driver and there's actions that you can take. Or another way to equate it to is like with Credit Karma. You have a credit score, just like you have a life score with this, right? And so it's that gamification that allows you to kind of move forward. And maybe for the example, maybe for your health insurance, I look at almost like an alarm system that that you're putting on your house, that you have essentially a extra benefit that's happening to a healthier employee base, which now makes your employees healthier, which then in turn makes your benefits better, your premiums better, and just a win-win. So I guess anything to expand on that?
Yeah, I guess the only thing is that I would like to see it be a situation where we can get the Champ plan working with all healthcare providers so they can actually be, again, going back to that win-win thing. My employees are really loving it. One of the things I was going to talk about was going to be actually rolling it out to even the part-time associates as well.
Okay.
Because right now we have the full-timers, but I'm hoping that down the road we can actually see our part-time associates enjoy those benefits too.
Yeah, and actually at the time of this filming, there's actually two different versions of this. There is the full-time people where it's the full deduction, the full savings, and there's also kind of a light version where the savings aren't as much, but allows those part-time or those people that maybe were negatively affected to actually be part of that entire thing as well. So actually good news, we already read your thoughts.
Wonderful. Yeah. That's great news.
And I guess it feels like a lot of employers that we talk to, they love the idea. It's a no-brainer across the board, but the actual enrollment process, I know a lot of HR people really know how important this is, but they're worried about that enrollment. They're worried about how that message gets translated, what the employees end up thinking about. So can you maybe speak in detail of the actual enrollment process, everything from the auto-enrolled to everything else kind of behind it?
Yeah, it's funny you say that because that was one of the things that went through my thoughts and my HR people. They were all worried about it because it's extra work for them. Okay, but to be honest with you, your team works with us so easily. It made it really an easy transition. And again, going back to that was one of the concerns I did have was that. And Matt was just amazing. His team and your team was really nice to work with, and it went by really simply as probably one of the easiest transitions we had for any healthcare for that.
Well, good. I really appreciate you saying that, and I guess we get Christmas bonuses this year for everybody, so that's great. So they can thank you for that too.
Well, one of the things I do want to mention to anybody who was really hesitant about it, please give me a call, because again, I'm not really getting anything for this. I just wanted to do it because I just think it's that important for employers to take advantage of this, because I saved a lot of money, in fact, thousands on a monthly basis. That if you have any concerns, get back to me. I'll give you my cell number. I'll give you my work number, my email. So if you're interested, please do that. My cell is 414-840-2642. My store phone number is 920-387-3220. And it's cschmidt@shopthepig.com. Give me a call, get me an email. I'm willing to talk to you. In fact, Matt has about 10 different people talking to me the last couple of years.
All right.
And I'm hoping that those folks join you, because to me, again, no brainer. Save yourself tons of money, save your employees money, give them the best benefits. And what's really good about it too is that we give the government less money. I like that too.
Well, actually, that is something actually worth talking about because, when we get through all those different concerns and we kind of overcome that, the funny thing is I would say maybe 1 in every 5 people say, well, I'm concerned about my employees with their FICA, their 401k, but even just the Medicare, their Social Security, right? And I guess, what's your perspective on that? That yes, you are paying less in taxes. Yes, it's funded by the taxes that you're saving. What's your take as a business owner and maybe that employee perspective as well?
Boy, it's funny you say that because honestly, anything the government touches, in my eyes, this is my opinion, is that they screw it up. So why not give that money back to the people, give it back to the employers, give it back to your employee, and let them invest it in the way they feel fit. Let them have a little bit more money in their pocket. That's my perception of it.
Yeah, and I'm going to get the numbers wrong, so we'll put a disclaimer on there that this is not actual tax advice. But we were talking about how if you had taken the same amount of money that you have over 40 years put into your Social Security, at a very reasonable interest rate, you'd have like $1.7 million. And through this whole thing, what you'd have right now, current day with your Social Security is like $95,000 out of $100,000 like total investment, right? And it's crazy to think that our government can do that bad of a job allocating those funds. And so I guess we look at this as a bird in hand today that you can actually then give your employees a true value add. I mean, you're effectively giving them a raise by doing that, right?
Exactly. And then the other thing I want to mention to all the employers, I'm sure you're aware of this. We all know the government's been giving free money out like it's candy, and it's going to affect us eventually. The rates are going to go up for us as employers. So if you could take advantage of anything from a tax perspective, again, going back to being a no-brainer, that's what it is.
So the feedback that you've, I guess, gotten from your employees, the savings are there, benefits there. What do you think the highlight is, or what do you think they like best about the plan?
I think they like the best about it, the plan is the prescription benefit.
Okay.
Because again, going back to prescriptions, the cost of that is so high, and with that plan, Champ plan and our regular healthcare plan, it's like they're paying nothing for anything, and they love it.
Can you expand on that prescription part? And maybe speak to someone that has an existing major medical plan right now, and they say, well, all of our benefits are already covered. Like, we already have prescription coverage.
Right. Well, instead of actually paying a certain copay, with the Champ plan, they're basically paying no money out of pocket before they even have to dig into their money in their wallet for that. So being a person that is interested in my employees, because again, we want to make sure that we keep good people, we want to give them the best plans. So along with a great healthcare plan, which I have, that's why I'm super excited about the Champ plan as well. Awesome.
Now, in your perspective, strictly as an owner, what do you like most about it?
I like the tax savings on it.
And I think most people would agree with you. That the other answer that I hear is how much it actually helps the retention, the recruiting. And we illustrate this, and a lot of the groups have already seen this, where they have maybe an existing $400 a month for their health insurance, but with the savings that employee is making, now is essentially a way they can add their spouse, they can add their children onto it. And it's amazing how prohibitive health insurance is in terms of costs. So what you're doing is essentially giving them a raise for free that didn't come out of your pocket, right?
Exactly. Tax-free. We love it.
Awesome. So, I know we talk about the tax benefits, but something that I think is overlooked a lot is how much it actually helps your major medical plan, in a sense, stay healthy. So what's been your experience in terms of like your renewals and things with that?
Oh my God, that's really a good question too, because rates are going up for most employers.
I thought of that question, so I appreciate that. That's good.
Yeah. That was brilliant.
Thank you.
You can pay me later.
All right.
But anyways, our employees have actually seen a downtrend the last couple of years because of the Champ plan, plus also the more focus on their health. Okay. I think that's a big part of the Champ plan. By focusing on your health, just like getting on a scale on a daily basis, you can be much more conscious of what you're eating throughout the day when you know the next day you're going to get on that scale. Same thing with the Champ plan. When they're doing something that's going to be once a month, they have to do some simple little thing on the app, but it's going to be something that they're going to be, top of mind. I think that's important.
No, we joke about and say, how much time does your employee spend either on Facebook or those dumb slot machine apps or whatever? And we're saying this is $900, $1,000 an hour for that 5 to 7 minutes it takes a month of what they're actually getting from that. And the funny thing I think about this, or really the ingenious thing, is that you now, almost through like a gamification, are allowing your employees to subconsciously make better decisions. And I equate it to like Credit Karma, where again, like it doesn't help you get a better credit score. Champ doesn't make you a healthier person, but it gives you the tools along the way to say, if you paid these 2 credit cards off, this would simulate your score. And so I guess in the actual like the score, the app part of it, is there any kind of things that you'd like to highlight with that?
Yeah, I'm glad we're talking about that too, because, again, a lot of people at first were like, oh, now I have to do more work for this. But we actually made it a fun thing to do at the store, because we talk about it sometimes, and that we actually have a tablet at the store for people that don't have that, because that's, again, going back to that question. Oh, I don't have a smartphone, I don't have this. So, what does it have? Most employers have tablets of some sort at the store or at your business, and all of our folks now have a chance to do that. And again, we make it a fun game, because this way they have certain scores on that app, and a little bit of an inner competition as well.
Yeah, no, and I think for, even for HR people, I think the camaraderie, the competitiveness, I don't think for any company that's ever a bad thing, and I think it joins people together. It kind of helps get a deal, and it's like, hey, you have that maybe that one person that just doesn't want to be at the bottom, and that one thing could potentially make a difference of them having a stroke 15 years or not. So I think that's perfectly said.
Well, I want to throw one more thing out there too, because of the Champ plan. One thing we also had is we actually had one of our full-time people, not even a department manager, that they actually loved it so much because of going on there once a month. They actually lost 20 pounds, and then people loved to see that Terry, her name was, Terry, you lost 20 pounds, you look great. So
congratulations, Terry.
Yeah, her confidence is up. But one thing Terry did then was we actually came up with a weight loss challenge because of that. So she actually headed that up for the store, and we actually had our employees get involved in that. And in 2 months, we actually had about 2,000 pounds of weight loss throughout our whole store because of that.
Wow.
So how something so small could go into something so large.
I guess when you're talking about in theory, this is a simple concept. You're essentially having Section 120 deduction, and you're having an insurance claim paid non-taxable. But even though it's a simple in concept, I think it's really easy to get lost in the weeds and the different components of the plan, right? So as an owner, how would you explain to another owner who's maybe just hearing about this now? Does that make sense?
Yeah, no, it definitely makes sense, a lot of it. I guess what I would do with them is actually have them talk to like yourself, Matt, anybody in your Champ plan team, and look at everything and ask questions like I did. I'm the kind of person, before I jump into anything, I always ask questions. I am like, well, what if, or but, what about that? And again, I probably was driving Matt crazy at first because I was asking those questions, or even a couple of days later, I'd be like, well, I'm not so sure about this because I got, questions about this, or some of my employees brought up these kind of questions. And he reassured me. He actually went through things very, very diligently and detailed, where it's like I feel very confident about talking to my employees about the plan. And again, I think that's why we have pretty much all of our folks on the plan at this time.
Yeah, it is something that at the end of the day, you're literally paying your employees to give them health insurance for free, and you're, as an owner, getting paid too. So that concept is really like, again, this that too good to be true kind of thing. And I guess just maybe in a different way, how would you maybe address it to an owner that feels like I understand it, but it still feels too good to be true?
What do you have to lose? Basically, get on the plan, see for yourself. After a year, you'll say to yourself, God, I wish I would have been on this plan years ago. You wish you would have saved money. You wish, like 10 years ago, I wish they would have rolled this out. To be honest with you, that's why I look at it as I've been doing this business for 36 years, and I've only received the savings for 3. It's like, God darn you, Stephen, why didn't you get this earlier?
The best part, I think, that you said it early on is that you did it kind of in pieces. You rolled it out just to the management team.
Yes.
And I feel like that's a really good strategy for groups that are kind of on the fence, where you can see that rollout in real time. You're not going to get egg on your face, for some reason, kind of what your concerns are. But then especially at the end of the day, you're going to look back and say, all right, we had 4 people on this. What if I had all like 600 people? And what a difference that would have made for that 1 month. I mean, we essentially lost $60,000, $70,000 in taxes that month that we paid in by accident.
True.
Right?
But again, going back to that slow rollout, I think it actually made it better for us in the long run, because this way you actually have not yourself giving the message to somebody, because they're always like, well, what's in it for you, Curt? What's in it for your company? now you actually have people that are actually seeing the benefit, and then they talk about it, and then it keeps branching out and going further. So again, maybe a little bit of loss at the beginning because we didn't roll it out to everybody, but I'm kind of glad we didn't, because then it's not my word, it's everybody else talking about it.
Very true. And then the management can actually speak intelligently from their own experience. Here's what it looks like in real time. Here's my app, everything else.
Exactly. We've actually had a few people actually show them how it works themselves as well.
You have a lot of employees right now with lots of different income, skill sets, even language barriers. And I guess, what's your impression of the employee experience? Not only just rolling it out, but also using it.
Well, the employee experience, to be honest with you on it, is actually makes it more fun for the employee to get on top of it, because they're looking at their health themselves now on a monthly basis instead of something that they never would. And again, I think that's kind of nice, because this way you get a chance to see where you're at on a monthly basis. Plus, you're seeing the savings. And what I liked about it was that what we did, something different compared to maybe what some employers might not do, is that we actually have a chart on a monthly basis in the break room showing exactly what everybody is saving. And then at the year end, we actually have a grand total on that.
Wow.
So that is something that if you're going to roll this out, I definitely suggest you do that, because this is something you're giving your employees a great benefit by doing this. But if you don't promote it yourself, you're not going to get the credit as much. So again, chart it, do it on a monthly basis, have a grand total at the end of the year, and then people will see the savings and they'll be like, wow, look how much more of a benefit. So this way, instead of asking for a raise or those kind of things, they're already receiving extra money every single month as well.
Yeah, and you're basically giving credit where credit's due, where you've said, this is what I've done for you. And it kind of almost like where you've built it in your culture, it sounds like, from the weight loss to, where everybody's money is at. You're taking the full concept of what it does and actually made it a part of your whole culture.
Well, that's what we do. We actually, we actually put out there for people when we one-on-one with them. We're like, okay, this is your wage, but this is how much it costs for regular benefits, dental, vision, everything, and then the champ plan, so on and so forth, 401k. So guess what? You can't even look at it as an hourly rate. If you actually total everything in, your hourly rate goes way up because of all the different benefits that we give them. So why not shout it out? Because again, it's hard to find good people, hard to keep good people, especially in this day of age. So if this is something you can do to help you and your company out, plus get the tax savings, again, no brainer.
All right, awesome. So I know when it comes to language barriers specifically, we have, the app in multiple languages. Our staff can speak in whatever on that. But with any of the bilingual people or people that maybe English isn't their first language, has there been any difference or has it been any more difficult for them?
No, not really. In fact, actually, we're really blessed because we have one person that is very good with speaking Spanish. And that person, actually, her name is Terry as well.
Okay.
She works on the front end, but she actually goes out and actually teaches a lot of different things to our employees who actually speak Spanish, because it's more difficult for a lot of folks that speak English only to actually teach somebody. So once we roll that plan out, we make sure we got her involved, because this way, when we do have somebody coming in that speaks Spanish and has a hard time with English, she a lot of times will roll out a lot of the different education formats for them as well.
Okay. And so for companies that maybe don't have a Terry like that, and maybe it's just a bunch of people that kind of feel lost in it, I guess anything else in terms of like what the app does, or like our staff in terms of being able to roll that out or help them?
Yeah, actually, your staff could be educating them as well. But the thing is, going back to that app, one of the things that Terry did teach them was about the champ plan, but again, she did have that app that she could go to as a resource, and actually the person that does speak Spanish can actually go to as well. So we actually have 3 folks that are on the champ plan that don't speak the greatest English, but they actually are on a champ plan too because of that app as well.
Okay, and so basically having somebody, not even necessarily management, but somebody there that you can kind of empower and kind of act as an advocate for it to kind of help them.
That is correct.
Okay, awesome. Okay. So I guess in conclusion, we really appreciate having you. I really appreciate the sincerity and your years of experience with this. Anything in closing that you can think of that maybe haven't already said that you'd like to?
I guess the only thing I like to say is that, with the champ plan being what it is, I just would hope that maybe down the road you guys be looking at branching out and actually looking and getting more involved in different healthcare aspects, because I think it's so critical for us as employers to look at what's going to be better for our employees to hold on to them long term. If there's anything that you guys are going to be rolling out, I would love to see it, because so far what you've done is a winner. And I would like to see exactly what you guys are going to roll out in the future as well.
Awesome. Well, we are so excited and appreciate to have you. And that's exactly what we're actually doing. We're in talks with major carriers right now that are going to bring this as part of it. Just like how a safe driving app is that integral to a car insurance experience, the same exact concept, just as a no-brainer. So it's a way to keep the premiums down, keep people healthy, get people paid, and it just becomes the greatest thing that you've ever seen. So I look at this as, maybe groups that haven't seen about this, and not to equate it to anything too crazy, but like kind of with crypto, I think is a great analogy, where you have so much that is seemingly unknown. Unless you actually really get in the weeds, it's hard to necessarily go all in. And so this is something that, with you're one of the first early adopters in your whole company to do this, and you've probably, collectively, tens of millions of dollars that every person involved over the course of their lifetime is going to see, and it's just an incredible thing. So I'm so happy for you guys. And
well, thank you. And the thing is, in closing, I just want to say is that it doesn't take a lot more extra work. And all the work that we do as employers, we work so hard for pennies on a dollar. This was just something that was so easy that if we had a lot of more things rolled out like this, I wouldn't have to work so hard anymore.
That's true. Well, Curt, Schmidt with Piggly Wiggly, we are so appreciative of you coming, and thanks again for everything you do.
Well, thank you very much. I really appreciate it.
Absolutely.
Thanks, Stephen.